After your cervical disc replacement surgery, how do you sleep? I don't really care how you sleep. Usually the first night might be good to be raised up a bit. Keep the swelling down to the neck because we do go through the front of the neck. Often, it really doesn't matter. I'm a side sleeper, so I'm going to be at my side. I can't sleep on my back. You can sleep on your stomach if you want, on your sides, or any way that you're comfortable. The key is that you get sleep, because you heal when you sleep. All your healing really is done mostly at night, and it's important that you do sleep. If you look at all the clinical studies on sleep, all of them agree. You know how we disagree on everything in medicine? There'll be videos out there, Lanman's a crazy, wants to do disc replacements on everyone, and they'll be saying you have to fuse everyone, okay? There's always two sides. On sleep, all medical sides agree. Everybody needs 8 hours of sleep. I don't care how you sleep, as long as you sleep.